If you're seeing signs of aging, a wrinkle or two or 12 here or there, is Botox the way to go? Well, Dr. Charles Couture from TLC Aesthetics is here now with Botox truths every consumer should know. How are you, doctor?
I'm doing great.
Nice to see you.
Nice
I'm doing very well. Now, I have acknowledged on this show before, and I'll acknowledge it again, that I do get Botox. And I speak to a lot of people who are actually afraid of Botox. They're afraid of what might be in it, what they're injecting into their skin. Dispel those fears.
Okay. Botox is very, very safe procedure. This treatment is done all over the world. In fact, in the US, it always consistently ranks in the top 5 non-invasive cosmetic procedures.
So what signs of aging can people get treated with Botox? I mean, is it the crow's feet, the forehead, what else?
Botox cosmetic is FDA approved really only for the number 11 lines. However,
it's your scowl line, right?
Correct. Right here when you make the frowny face, you have these little lines.
Right.
But it's also used for the wrinkles across the forehead, the crow's feet like you mentioned.
Right.
What we call the gummy smile, Julia Roberts, you can drop down your lip.
Now we're looking at some pictures. This is a woman who is showing the scowl lines before, and the after is really unbelievable. I mean, it takes care of it.
Yes.
And similarly, more men are getting Botox, I think. Mm-hmm. And here we see a gentleman before and his after, and wow, it's really, it makes quite a difference.
Yes.
So people shouldn't be afraid of this.
No, this is very common. In fact, there's probably many people that we all know that are getting it. They may not just be revealing it. It's done in masses. As we stated, it's always in the top 5.
I think that stigma should go away, though. The fact that people get it and they don't admit it, just admit it. So what?
I agree.
You know, if you feel better, if you look better, what's the big deal?
I agree.
So let's take a look at some of the other befores and afters. There you're talking, wow, there's some real heavy worry lines in the forehead, and look what Botox does. It's great.
Yeah, thank you.
Yeah, and that's your work.
Yes.
You're proud of it.
Yes.
And then also the jowl lines is an interesting place to get it.
Yes.
And now sometimes people get filler there as well, don't they?
Correct.
If it's too deep.
Sometimes you can combine both.
And get the Botox and the filler. All right, now I have heard, and this may sound weird, but I've heard of people, and this, correct me if I'm wrong, getting it in the neck. Is that possible?
Yes, you can get it in. Yes. Some people have the turkey neck or turkey gel.
I'm getting it, doctor. So I may come see you.
You need to come and see me.
I do.
Yeah.
So really, it does work there.
We can inject, yes, and we grab the muscle here and then we inject into it.
Now, how long does Botox actually remain effective?
It's going to last about 4 to 6 months on average.
Which is great.
Yeah.
And it's not that expensive anymore. The prices are coming down.
That's correct.
Which is wonderful. All right, now if we are, buyer beware here, what should consumers be aware of when they are Botox shopping?
You want to make sure that the injector that's injecting you is trained and qualified. The person that's injecting you is getting the Botox from the only maker of Botox in America, which is Allergan. The other thing you want to make sure is that they're not over-diluting, adding extra salt water to the Botox to make it weaker. And the last thing is you want to make sure that the product that they're injecting is actually Botox, not Dysport or Xeomin, which are similar and effective products, but it's different.
Okay, and the good news is, for the holidays, you have a special. Tell us about that.
Yes, we do. We have our December special, which is 50% off our regular pricing for Botox.
Woo! I am going to see you. All right, doctor, for more information, log on to BotoxFun.com or call 813-874-1TLC. Over to you, Cindy. Thanks so much.
Thank you.
Great job.